Disseminate Lyme Disease. Definition. Lyme disease (LD) was originally identified in Lyme, Connecticut, when a cluster of patients present with an apparent juvenile rheumatoid arthritis, previously known as Lyme arthritis. The entity is now called LD because of its wide variety of clinical manifestations, including cardiac, dermatological, and neurological findings. LD is the most common tick-borne infection in the northern hemispheres. In North America, LD is predominantly caused by Spirocheta borrelia burgdorferi. Application in medicines. Although at periods of Lyme disease response to antibiotics, early treatment is the most effective to avoid a complication during the early stage of the disease. Oral antibiotic treatment with doxycycline, amoxicillin, or cefuroximine is effective.
When the ticks are active and seeking a host to be on is when you can catch the disease from the bite of a tick. Most of the time you catch it from being bitten by a little nymph of a tick, and that's one of the early stages, and they're most active in the summer and the spring. The first big reason for the increase is that there is an increased area and number of people that are potentially exposed. The second one is reporting. There's been quite an interest in having much more accurate reporting. It is a reportable disease here in Massachusetts, and relatively few of physicians in the state report all the cases that they potentially see. And as a result of that, we've had an education of physicians to report more cases. A major reason is that the symptoms are fairly nonspecific when it starts. In Massachusetts, we see about 70% of the cases present with a classic donut-shaped bullseye rash. That still leaves 30% that never get the rash, and so as a result, they present with relatively simple flu-like symptoms, which can be mistaken for lots of other things. The other piece that is important is that the testing is not 100% accurate. And the test, you can't do a simple test like a strep throat test and say yes or no, you have streptococcal sore throat. You have to interpret the results of the test in the light of the clinical symptoms. Knowledge about the possibility of becoming infected in the colder months is important for people to recognize. Second is that you can do things to prevent Lyme disease, both personally and in your environment, that will reduce your risk just by knowledge of the behavior of ticks. Ticks don't like open fields. They really are along the edges of properties. And so to the extent that you can clean up the brush in your neighborhood or in the area, you will reduce the chance of being exposed. To the extent that you can do accurate tick checks in good places when you go out in places where you might be exposed to feeding ticks, that's really important.
Pros and cons. There are three stages of Lyme disease. Localized early stage Lyme disease. This usually begins with a large red spot, erythema migrans, at the seat of the bite, almost always localized on the thin burrowed thumb and armpit. Lyme disease in early disseminated stage. At this stage, many sufferers experience turnings, chills, and fevers. Pigdash, stiff knee, muscle pain, and joint pain and swelling. Late stage Lyme disease, more than half of those affected develop arthritis, usually weakening in several months.
One of the great myths of Lyme disease is that it causes the classic bullseye rash in the majority of cases. This is a myth because the average rash of Lyme disease actually doesn't look like a bullseye. It is round like a bullseye, but it doesn't have the concentric ring within a ring like you'd see in a Target department store bullseye. That's actually the minority of rashes. The majority of Lyme rashes actually are round, but uniformly red, or sometimes even darker in the middle and then fade out towards the edges. So when these rashes appear without the classic target lesion, people often dismiss them and don't think they're Lyme disease. That's a huge mistake. Another myth about Lyme disease is that everyone has a rash. Unfortunately, not everyone has or recognizes a rash of Lyme disease. This may occur because the rash is in an area where they can't see it. It may occur in dark skinned individuals where the rash isn't as apparent. It also just doesn't appear in some people. It's known that not everyone with acute Lyme disease will have a rash. When this occurs, it becomes very difficult to make a diagnosis. If the patient with acute Lyme disease does not have a rash and only has those flu-like symptoms, acute Lyme disease looks like any of a number of infections. The common cause of misdiagnosis in early Lyme disease is the failure of people to recognize the Lyme rash. Both patients and clinicians often attribute Lyme rashes to non-specific bug bites or spider bites because when they don't see the ring within a ring target appearance, they dismiss the round or oval red lesion as just a bug bite or a spider bite. Early Lyme disease is what we call a clinical diagnosis. The diagnosis of early Lyme disease is based on the accurate identification of the Lyme rash. This is so important because the blood tests actually don't work in the early initial weeks of Lyme disease. It takes several weeks for the body's immune system to make the antibodies that are measured by the Lyme disease blood test. During this initial 2 to 3 week period, the blood test for Lyme disease will be negative. In that period, the antibodies haven't formed to a high enough level to give a positive blood test. The basis of the diagnosis of acute Lyme disease is the accurate identification of the Lyme disease rash. Our research has been trying to focus on ways to aid patients and physicians in the identification of this critical Lyme disease diagnostic rash. One way we found to be helpful is actually through the training of computers to do computerized deep learning or image recognition. This is similar to the way cars are taught to drive without a driver. They're taught to identify features in the environment. Similarly, we've taught computers to identify the typical Lyme rash based on photographs that patients take of their skin. Using patient-obtained images from cell phones, we've been able to train computers to read the rash. We found that the computer is actually more accurate than humans at identifying the Lyme disease rash. If you have hundreds or even thousands of images, the computer can be trained in a way that it recognizes all the variations in the rash, not just the rare classic ring within a ring target lesion, but all the variants that don't have the target appearance. All the variants that may be reddish blue instead of red, all the variants that may be oval instead of round. Computerized identification of the Lyme rash really has the promise to cut down on misdiagnosis. Our future plans are to integrate this computerized reading of Lyme rashes eventually to integrate that into telehealth. We've already begun doing telehealth diagnosis of Lyme disease. When I see those images on the patient's medical record, I can consult with them by a televisit and make a diagnosis of acute Lyme disease based on their story and the image of the rash that are all there on a televisit. They're obtained in a way that's private and into a confidential medical record that includes their pictures. The combination of talking to the patient on a televisit with those uploaded images of their skin rash, we can accurately make the diagnosis of acute Lyme disease without the patient ever having to come into the office.
Usually applied in Ecuador. Review the national medical literature. The case of Lyme disease has been written or reported in Ecuador. There is only the communication from Caleron Cops is suggests indication of its extension in the country if two cases with skin lesion, which did not have immunological verification. Conclusion. Lyme disease is a multisystemic infection caused by the spirochete Borrelia burgdorferi that is transmitted by dead beetles. The CNS is frequently involved with meningitis multiplicity chronicle, neuropathy, radiculopathy, and polyneuropathy, as well as encephalopathy, constitute the clinical picture.
We're talking about Lyme disease. So Lyme disease is an infection due to spirochete bacteria of the species Borrelia burgdorferi, which is native to North America, or Borrelia journei or Borrelia afzelii, which are native to Europe and Asia. So the Borrelia bacteria is transmitted by the Ixodes tick pictured here, and the tick itself will actually be infected with the Borrelia bacteria after biting a small rodent. So the small rodents, such as mice or rats, actually act as the primary reservoir for Borrelia bacteria. White-tailed deer act as the host for ticks. So the cycle of transmission is as follows. The tick, an uninfected tick will bite an infected small rodent, will carry the Borrelia bacteria, will either transmit the Borrelia bacteria to another small rodent, it can transmit it to a human through biting, and generally will attach itself to the host, white-tailed deer, and will lay eggs, and this cycle will continue. After tick attachment, an infection of Lyme disease generally occurs at least 36 hours after tick attachment or after the tick has bitten onto a patient. So the clinical presentation of Lyme disease changes as time progresses in the disease. There are 3 different stages of Lyme disease. Stage 1 is considered an early localized stage of infection. It usually occurs 7 to 14 days after a bite. The patient experiences malaise, fatigue, headache, and myalgias. And there's a characteristic skin lesion known as erythema migrans. This is called the bull's eye target. It's non-pruritic and it expands. So the outer ring will continue to expand out and there will be a red center, but it is a non-pruritic skin lesion. Stage 2 is considered an early disseminated stage. It usually occurs within weeks after a tick bite. There are central nervous system symptoms such as neuritis, cranial nerve palsies, and meningitis. There's also cardiac symptoms. We see something known as Lyme carditis occur in this stage. This is where we see myocarditis and some AV blocks. Could be first degree, second degree, or even third degree block. In stage 3, this is considered a late persistent stage. This usually occurs months to years after a tick bite. The patient experiences chronic arthritis, could be monoarticular or oligoarticular. There's also neurological symptoms involved. There's symptoms such as neuropathy, meningitis, and encephalopathy. And with regards to infections with Borrelia evzelii, we see another characteristic skin rash known as acrodermatitis chronica atropicans. So it's a reddened skin rash in different parts of the body. An easy way to remember the clinical presentation for Lyme disease is the mnemonic, bake a key lime pie. So we've heard of key lime pies. Many of us have eaten key lime pies. So you got to think of bake a key lime pie. The clinical presentation is in the word bake. B stands for Bell's palsy. There's also arthritis. We mentioned this before. There's also cardiac block. We use K for cardiac, even though it doesn't spell cardiac, but this is an easy way to remember it. So cardiac block could be first degree, second degree, or third degree AV block. And the E stands for erythema migrans. So those are the 4 keys for clinical presentation of Lyme disease to help us remember what the clinical presentation of Lyme disease is. Bell's palsy, arthritis, cardiac block, erythema migrans. So how do we diagnose and treat Lyme disease? The diagnosis can be concluded through the clinical presentation, such as seeing a characteristic bullseye target lesion, such as erythema migrans. Or we can do serology looking for anti-Borrelia burgdorferi antibodies. We can use ELISAs or Western blot to detect these antibodies. For treatment depends on the stage of the illness. Stage 1, we use amoxicillin or doxycycline or cefuroxime. For stage 2 to 3, we want to use ceftriaxone. For prevention of Lyme disease, we want to take care to ensure that there are no tick bites. But if there are tick bites, we want to use an antibody prophylactic treatment, and that is normally doxycycline. We usually use this within 72 hours of a tick bite. But with doxycycline, we always want to remember that it is contraindicated during pregnancy, lactating women, and for children under the age of 8 years old. So anyways, guys, I hope you found this lesson helpful. That was a quick lesson on Lyme disease. If you found this video helpful, please like and subscribe for more videos like this one. And as always, thank you so much for watching, and I'll see you next time.
Fence.